My part in the whole Hunterdon Orthopedics is the conservative part of spine management, and we work as a group with the spine surgeons that we have. My end is to avoid anything invasive or surgical, and I'm supported by the surgeons in that. And to me, the most interesting part is the initial visit, because they bring all this information, and a lot of the times I do have patients who have been through multiple doctors and have not been really able to diagnose the problem, and a lot of family doctors in the area are now sending me more difficult patients, as we may say. And that is the most interesting part, is to see what's going on and to listen to what they have to say, what has been done and what has worked and what has failed, and then put my own two pieces together and figure out a plan of action. And there is always a backup plan. You have a plan 1, plan 2. If this fails, there's another option. If this fails, surgery is an option, and what kind of surgery would be a good idea. So it is absolutely very interesting to me to put the puzzle together. The whole goal of my practice is to be very conservative. It could be something as simple as just giving them home exercises and anti-inflammatories, and it could be as complicated as putting a needle inside their disc and taking out this material. And all of that is basically geared towards function and getting our patients back together. The sooner you treat pain, the better it is. The more prolonged it is, the worse off it is for the patient, their psychology, their function, their jobs, and their work, and their families. Patients today are very well informed. I believe that they are looking for attention, answer to a lot of questions, and obviously looking for good medical care. And they are able to compare now that it's the age of internet, Google, PubMed. So they do come with a lot of information. They do come with a lot of concerns and questions. They have already compared a lot. And I believe that we are able to answer all of their questions. And they usually are satisfied, otherwise they wouldn't be staying with our practice, because there's so many options. The most important thing to me is when people get better. That's what it's all about. I do interventional spine. That's the main part of my practice, is spine and pain management. And I do find that people come to me with chronic pain. They've been using a cane for years, and then I do a couple of injections and epidurals or some of the other procedures that I do, and they walk back and they're without their cane, or they're using a cane after they were using a walker, and that's the most gratifying thing to me.